First off, talk to us about the impact of Pepfar, especially with regards to the work of EGPAF, addressing children with HIV/AIDS or preventing mother-to-child transmission.
Well, you made very important comments in your opening there in terms of the overall impact of Pepfar over 20 years. I mean, it's been transformational. And Pepfar turned to the Elizabeth Glaser Pediatric AIDS Foundation at the start of Pepfar, really to focus in on stopping mother-to-child transmission. Fast forward to today, it's just remarkable the treatment that we have, the low cost, fraction of what it used to be, reduced new pediatric infections, more kids on treatment. The pediatric age group is still lagging behind adults in terms of those living with the virus and not being on treatment and so on. But Pepfar has just been phenomenal, as have the partnerships with ministries of health and community groups and so on. We still have a big job to do, though, and that's what is in front of us.
And the job requires money. One of the issues is funding renewal for Pepfar. So Pepfar remains funded for now, but Congress has not passed a longer-term extension of the program. What are your thoughts?
Let's be clear about the difference between reauthorizing Pepfar, and that's the challenge at present, versus funding for Pepfar. What we strongly urge in really daily discussions here in Washington, D.C., is that Pepfar be reauthorized for 5 years, as is. This would be the fourth reauthorization of Pepfar. That should have technically happened by September 30th, i.e. Friday last week, which is the end of the U.S. government fiscal year. It has not been reauthorized, and there's an argument, a battle over whether it should be reauthorized. What's important to note, though, is the funding from Pepfar for services and programs in the field. That funding can and does and is continuing. Pepfar is still working. Our colleagues are working today and this week and next month and so on. The distinction is it's politically disappointing that Pepfar has not been reauthorized, but the work will continue. And what's really very important about that reauthorization is it really does express what exists still today, which is strong bipartisan, Republican, Democratic support for Pepfar. Okay. That's still in place.
Okay, Chip, we have to leave it there. Thank you so much.